So I'll just start us off with some basic introductions and just want to say welcome to everybody who's joining us right now. We're really happy to have you here for this webinar. My name is Alyssa Harlow, and I am the director here at MD2B Connect. I am here based in Michigan. I have a fiance and 2 cats. Those are my fur children. I went to U of M Dearborn, so I am a Michigan native. And a couple of my hobbies include reading, Pilates, and drawing. So those are just a few things about me. I've been working at MD2B Connect for 6 years, going on 7 now. So I am doing a lot of different things on the team. Some of my main goals are with the marketing campaigns, social media, email marketing. I have a lot of different hats that I wear. So that's only a part of the surface of what I do. So, but I will go ahead and pass it off to you, Manish.
Okay, thanks, Alyssa. So my name is Manish Subnis. I'm one of the co-founders of MD2B Connect here, along with Dr. Desai, who you'll meet in a minute. So we started the company about 7.5 years ago, and my responsibilities here are the operations, finance, a lot of the administrative and staff type of things, IT. So very many different roles. And before starting the company with Samir, I was my background and was in engineering and finance. So it was a completely different pivot to get into the medical world. It's been a very enlightening and rewarding, to be part of the medical education process and helping people out. Personally, again, as Alyssa mentioned, I live in the Detroit, Michigan area. I have a wife and 2 daughters who are in their teenage years, and just enjoy spending time with friends and family, traveling, reading anything sports related. So some of my personal hobbies there. So excited to talk to everyone today, and I'll hand it over to Dr. Desai.
Yes, well, thank you, Manish. Before I tell you a bit about myself, Radhani, did you want to say a few words about Soma Health?
We skipped that. Yep.
Yeah, sure, I could do that. So hi, everybody. Thank you so much for joining us today. So before I think we dive into why we're all here today, I just wanted to quickly introduce myself and the Soma Health team. So my name is Radhani Sanghai, and I'm a partner here at Soma Health. We are a boutique healthcare consulting company based out of Bombay. And at Soma, we work very closely with healthcare professionals like yourselves to build sustainable, thriving ventures. Because we know that your primary focus should be on patient care, our goal is to help keep your attention there while still growing, streamlining, and strengthening your practice. So we work across 3 core pillars. There's practice management, the second is strategy and growth, and the third is philanthropy and community impact. So within practice management, we support doctors like yourselves in building a strong online presence. And that can range from social media help to websites, because today patients are looking online, and if they don't find you, unfortunately, they'll find somebody else. So for more established practices, we also help with digital integrations. That could be EHR systems, audits, workflow restructuring, and staff training programs. So if your organization needs marketing, restructuring, or even just a little bit of fine-tuning, we're here to help. Our most popular service offering with young doctors is actually strategy and growth. So we help you build strategic partnerships, and that could look like connecting you with senior doctors for a referral program, or even creating like a collaborative structure between you both. We also work on patient outreach through public health camps, offline activations, and panel discussions. And of course, we help build digital healthcare brands with targeted marketing strategies that actually truly resonate with both patients and providers. So I know that's a lot, but in short, I think Soma Health is a one-stop shop for all your healthcare business needs. So do follow us on all our socials to stay updated on the exciting collaborations we do with some fantastic organizations like MD2B Connect. And yeah, with that, delighted to hand it over to Samir, who will kind of take you through the next part of today's webinar.
Okay, thank you, Radhani.
The recording has been resumed.
So welcome to our webinar today, jointly sponsored by MD2B Connect and our dear partner in India, Soma Health. I want to give you all a very warm welcome. We're excited to have you, and we've got a great topic to go through in depth today. Just a little bit of information about me personally. So I was born and raised here in the United States. Like Manish, I grew up in Michigan. We've actually known each other for our entire lives. So we're very, very close friends. Fun fact about me, from the age of 1 to 5, I lived in India. I was very, very young, but from what I understand from my relatives is that at that young age, I would be found walking around with a cricket bat on my shoulder, either pretending to be the famous Indian cricketer Sunil Gavaskar, or of course, my favorite Hanuman with his mace on his shoulder. So I'm of course now here in the United States. I've done all my schooling here, grew up in Michigan, did my residency in Chicago, and now live here in Houston, where I'm a professor at the Baylor College of Medicine. I'm going to tell you a little bit more about me, but first let me go ahead and share my screen, and so that we can all get ready for our presentation here. 1 second.
Yeah, and while you're pulling that up, Dr. Desai, I'll say that a lot of you submitted questions in the registration form, so we'll be able to answer those towards the end of the webinar. If you have any questions during the webinar, there is a Q&A box where you can kind of drop your questions. So please feel free to do so during the duration of the webinar. If we have time at the end, then we might answer some of those. But if we don't have time, then we'll just answer the questions that were submitted in the registration form.
Okay, Alyssa, do you see my screen?
Yeah, I can see your screen. Do you want to advance to the next slide, make sure that works?
Yeah, is that working?
Yep, looks great.
Okay, perfect. So let's go ahead and get started. We all would agree that the road to residency in the United States is a difficult one. There are many decisions to make. It's a complicated process, and there's a dizzying amount of information that is out there. And so at MD2B Connect, what we do is we want to empower this next generation of physicians who will train and practice in the United States. And you are our future. And so we have a strong commitment to nurturing this next generation. And among the most important decisions you'll make for your future is your choice of U.S. clinical experience. U.S. clinical experience plays a vital role in reaching the ultimate goal of successfully matching in a residency program based in the United States. And there are many questions that arise about when should I do it? What should I do? How do I pick the right experience? And we're going to demystify this process here today, give you very specific information that will allow you to take the right actions to get you closer to a successful match. So I told you a little bit about myself, but let me tell you a little bit more. You know that I'm co-founder of MD2B Connect with Manish. I did my training in the Midwest. So I was in Chicago for 4 years, where I completed my residency and stayed on to serve as a chief resident at Northwestern University in downtown Chicago. Immediately after graduating from residency, I took a position at the Baylor College of Medicine here in Houston, where I've now been here for 25 years. And in my specialty of internal medicine, I serve as what is called an academic hospitalist. So I work very closely with our internal medicine residents and our Baylor medical students. I wear different hats here at Baylor. In addition to being a clinician, I have served on various committees, including our medical school admissions and residency selection committees, not just here at Baylor, but at my previous post at Northwestern. And In wearing these different hats, it's given me a lot of joy in my professional life. I love to teach. I'm very passionate about teaching. I was fortunate to have some great mentors in my life who guided me along the way. So I love to give back through my own mentorship. My research at Baylor is mainly educational. So I do research on optimizing learning during rotations, electives, and clinical experiences. And I've also developed a love for writing. And over the course of my 25-year career, I've written a number of books. Let me introduce you to some of the books that I have written. I have a series of books that were written to help the future physician navigate the many challenges and complexities of becoming a doctor. We know that no matter where you go to medical school, it's a very, very difficult process. And so I've written books on how to get into medical school that you'll see here on the left of your screen, succeeding in medical school, whether it's your basic sciences or your clinical rotations, and then to the far right on this slide, matching successfully. One of the books that is in use at many U.S. medical schools across the country is a book called The Successful Match: Rules for Success in the Residency Match. We update this book periodically. The most recent edition was just released just a few months ago on the Amazon Kindle. This is a book that in its previous edition was 600 pages, so quite lengthy, but now, because of all the advances and the changes that have occurred in the residency selection process, we absolutely had to update the book. And it's in its current iteration, it is over 1,000 pages with chock full of very detailed information and strong strategies. In its previous edition, it was recommended by the AAMC Group on Student Affairs as a high value resource. The AAMC is the same organization that oversees important aspects of the residency application process in the US, from the residency application to visiting student rotations from international medical students from across the world. Now, although this talk is focused largely on US clinical experience, that's not the only thing we're going to cover. So I want to go over some of our objectives and goals for this talk. We want to, at the end of our session here today, have a stronger understanding of the residency selection process in the US. We absolutely want to be in a position to take actions that will position ourselves for success in the match. We don't want to be harmed by inactions. These are common and frequent. We want to avoid the inactions that prevent success in the match. And we want to learn how to assess the US clinical experiences out there so that you can select the right one for you. And so we're going to be using sound strategies to create the overall US clinical experience plan that is right for you. And if we do this correctly, we will put ourselves in a position to earn strong letters of recommendation. I want to draw your attention before we get into the nitty-gritty of how to get to where you want to be in US medicine to a recent article. It was published in March 2025 in our journal Annals of Internal Medicine. The title of this article was that international medical graduates are integral to the delivery of patient care in the United States. This is absolutely true. Over my 25-year career, I can just tell you so many examples of IMGs that have made incredible impacts in patient care, teaching, research, and so many other areas. So this article highlighted the fact that we're going to have a shortage of physicians. By 2037, they pointed out that we would be short 187,000 physicians. And there's an effort here in the US to increase the number of our US MD and DO graduates. But even with the expected increase, we're not going to have enough graduates to meet our physician workforce needs. So there's not enough US medical graduates to fill our available residency positions. And therefore, IMGs will continue to play a vital role. In the US, we're very multicultural, we're very multi-ethnic, and the diversity of our patient population requires us to have an equally diverse physician workforce. And IMGs have historically played an immensely important role in meeting the diverse and complex needs of our patient population. So they have contributed in so many great ways, and that is vital to the success and sustainability of our U.S. healthcare system. Now, even though we know that IMGs are vital to our U.S. healthcare system, getting from where we are today to a successful match and starting our careers in the U.S. is not an easy process. It is challenging, as we said, full of twists and turns, and that road becomes easier to traverse the more informed we are of the different aspects of the residency selection process. Now, this process for most people begins with the USMLE exams. Now, I want to draw your attention to some important documents that are released by the NRMP. The NRMP is the National Resident Matching Program. They are the entity that oversees the match. And every few years, they do important surveys of program directors where they ask program directors, what are the factors that are important to you in selecting your applicants for interviews? And I want to share with you some of that data. So you can access those important documents at the NRMP website. One of the things that you will find from the most recent survey of PDs is that the Step 1 exam is the most important factor in making interview decisions. In this survey, they also ask the PDs to rate each factor on a scale of 1 to 5, with 1 being not very important and 5 being very important. So the Step 1 exam has a mean importance rating of 4.5. Now, in this next slide, I want to compare these two pie graphs. And these two pie graphs are about pass-fail rates for IMGs with respect to the Step 1 exam. And on the left, you see 2020 data. On the right, you see 2024 data. So if you look at the pie graph on the left in 2020, you'll see that 87% of IMGs passed the Step 1 exam and 13% failed. Now, if we look at 2024, we see some market changes here. The pass rate has fallen, the fail rate has gone up quite significantly. And what is it that has happened between 2020 and 2024? Has the exam gotten harder? The exam has always been hard, but it's not that it's gotten harder. What's really happened is that the exam went from numerical scoring to pass-fail scoring several years ago. And when anything goes to pass-fail scoring, there's a perception that, hey, it's not too hard to pass this exam. And that couldn't be farther from the truth. This is a difficult exam. And just because it's now pass-fail doesn't mean that it's any easier. So this being, an important first step for many of you, it also serves as a barrier to entry for people who perhaps don't take it as seriously as they should. So take this exam very, very seriously, get that pass, because that is crucial. We know that this exam is highly important to selection of residents. Now, when Step 1 went pass-fail a few years back, we surveyed program directors and we asked them, what's going to be more important to you in the selection process now that Step 1 is going pass-fail? And so we got a lot of information from PDs saying that we're going to put more importance on Step 2. And that, in fact, is exactly what has happened. A Step 2 exam is now the second most important factor when making interview decisions. It also carries a high mean importance rating of 4.2. Keep in mind that many programs have what we call cutoff scores. So if your score doesn't exceed that cutoff score, they may not take a look at your application. So USMLE Step 2, also very important in the process. Now, there's a feeling among many applicants that it's all about the USMLE. That's what gets you in to US-based residency. And there's no question that USMLE scores are important, but I want to caution you from thinking that they're everything, because US-based residency programs are going to look at everything. You will hear stories of people who are high scorers, 260s, 270s, who get very few interviews, and you will hear stories of people who don't have those high scores who get more interviews than their high-scoring counterparts. So we know that USMLE is predictive of medical knowledge, and we know that it's a good predictor of how residents will perform on future board exams at the end of their residency. However, being a successful resident is much more than having the medical knowledge. It's about so many other things, right? And we know that there isn't a very good correlation between scores and faculty ratings of residents in many areas, including our clinical judgment, our patient rapport, our work ethic, and this is just to name a few things. So let's talk about what else residency programs are looking for. So if it's not all about the USMLE, what are they looking for? So we can look at the words of the John Muir Family Medicine Residency Program and how they define what they call is the ideal resident. So they are looking for someone with excellent interpersonal skills, a strong work ethic, commitment to patients and colleagues, an enthusiasm for learning, and a sense of humor. They want people who will contribute to their diverse team and show respect for various beliefs, values, and perspectives. They want forward-thinking risk takers who can own their mistakes and learn from them and be open to change. And they want people who are continuously going to be in the pursuit of lifelong learning. So obviously you can see from this that the USMLE is not going to tell programs all about these things. Now, how are programs going to assess you for these qualities and skills? They will do it in various ways. They will look at your extracurricular activities, those experiences that you do outside the classroom. They will look at your US clinical experience. They will look to see what your letter writers write about you in the letters of recommendation, and they will assess that in the residency interview. So we're going to take each one of these one at a time, starting with the extracurricular experiences. A colleague of mine, Dr. Nicole Taylor, former Associate Dean of Student Affairs and Associate Program Director at Wake Forest University School of Medicine, puts it very well. She says, we like to see a well-rounded applicant and assess them based on their non-academic endeavors. So please note the underlined part of her quote, well-rounded applicant. So what does that mean? That means that we need to get involved in different type of experiences, and we can take some guidance from the same survey of program directors that I mentioned to you before. So when these program directors, again, were asked, how important are different factors in inviting applicants to interview, 72% of PDs cited leadership as a factor that they look at when making their interview decisions. 61% cited volunteer or extracurricular experiences. 41% were interested in an applicant's involvement and interest in research. Now, these are not the only things that fall under the category of extracurriculars. There are many, many different things that people can do to show well-roundedness. And we should, for a moment, talk about why well-roundedness is so important. So currently, if we're just talking about internal medicine, there are some 500 to 600 residency programs in internal medicine. They all have different missions and goals. And if we want to appeal to the widest range of these programs, it behooves us to become well-rounded. And we can do that by following our passions and interests in these different areas. So we can carve out a niche in teaching. We can show that we have a passion for mentoring. If we're interested in research, we can build a profile in research. You saw from the previous slide how important leadership is. So we can look for leadership activities and community service and advocacy and policy. And the list goes on. There's many different ways to become well-rounded. But this is something that programs are absolutely looking for, and a great way for you to show fit with a range of programs so that you can draw their interest in the form of an interview down the road. These qualities and skills that residency programs are looking for, yes, they can find some of that through your extracurriculars, but they will also look for evidence of that through your letters of recommendation. Letters of recommendation have always been important in the selection process, and they communicate an applicant's potential for success to the program. Many surveys, survey after survey of PDs, have shown that letters of recommendation are highly important. In fact, they are currently second in importance in the selection process after our STEP scores. Unfortunately, letters written by physicians in other countries don't carry much weight in the US residency selection process when you compare that to letters written by US-based physicians. And I'm going to share with you a very stunning statistic that often surprises people, but in one survey of program directors, only 7% felt that letters written by physicians in other countries were useful. And it's not that your prior experience isn't important to residency programs. It absolutely is. Your medical school education, if you've done a residency, all of those things are heavily factored by residency programs. But the fact remains that you are now applying for a position in the United States that is largely clinical. So they're looking for evidence that you'll be able to apply those skills from your home country in a US clinical context. When you talk about letters, clinical letters are what are most highly valued. And we get these clinical letters, ideally, from our US clinical experience. But the benefits of US clinical experience go well beyond the letters that we earn from these experiences for our application. We are able to list our US clinical experience in the residency application. We're able to describe them in great detail, and program directors look very carefully about what we've done. They do more than enhance the strength of our application. They demonstrate your readiness for US medical residency. Remember that programs are looking to ensure that when you start their residency program, that you're going to be somebody that's ready, willing, and capable of transitioning into the US system. They show evidence that you are familiar with the US system. They allow you to do networking with the preceptor that you're working with other physicians in the city or area in which you're rotating. And that's an important part of this process too, is finding people who will support you in the form of mentors or advocates. And then of course, US clinical experience can help you stand out from other applicants. Now what I want to do is give you a blueprint, a way for you to assess the US clinical experiences that are out there so you can make a highly informed decision that will allow you to secure the US clinical experience that you deserve. So the first step is to decide on how many months of USCE to complete. I will tell you that most applicants will complete 3 to 4 months of US clinical experience. Now, why do they do that? So in the US, we typically earn a single letter of recommendation for every 1 month of US clinical experience. Since most programs ask for 3 letters of recommendation, doing 3 months of USCE will secure us those 3 letters of recommendation. Of note, the maximum number of letters that you can send a program is 4. So some people will do 4 months of USCE. Now, even though most people do that, there are people who do more than 3 to 4 months of USCE, and that gives them the competitive advantage. There are some groups of applicants that will highly benefit from additional US clinical experience. Examples would include people who have a long clinical gap, people who have a year of graduation that's further back in the past, applicants who have low step scores or have attempts, and finally, applicants who are applying again after an unsuccessful outcome in prior matches. Now, one important thing to keep in mind is that some programs will simply not consider an applicant for interview unless you reach a threshold number of USCE months. I'll give you some examples. So the Northwest Healthcare Internal Medicine Residency Program writes on their website that we require all applicants to have a minimum of 3 months US clinical experience. The BB Healthcare Internal Medicine Residency Program asks for 6 months. Wake Forest asks for at least 1 year. So the more you do, the more programs you unlock. If you get to 3 months, all those programs that are looking for 3 months, you will unlock those as potential possibilities, for your residency match. You do more than that, that will unlock another set of programs. So these are some things to keep in mind. Now, we often get the question, can you match into US residency without US clinical experience? Now, at many programs, USCE is required, and you'll see that language on the website, and it will often be very emphatic. We will not interview candidates who have not obtained this required clinical experience, writes the Thomas Hospital Internal Medicine Residency Program. At programs where USCE is not required, it is often preferred. So the University of Texas San Antonio Internal Medicine Program writes that while US clinical experience is not an absolute requirement, it is highly encouraged. And even on those websites for programs where USCE is not required or recommended, if you closely examine the profiles of the residents who are training there, you will find that many of them have had significant USCE prior to starting residency. So some key points: residency applicants who have USCE will often secure more interviews than their counterparts if everything else is equal. The other thing to note is applicants who have USCE will attract a different mix of residency programs than those who have no such experience. So for example, if you hope at the end of your training to have trained in a competitive subspecialty like cardiology or gastroenterology, then you having completed USCE may attract you programs that are better fit to help you get to that ultimate goal. Step 2 is to prioritize hands-on US clinical experience. Residency programs have been known to indicate that shadowing or observership experiences do not count as USCE. So the Augusta University Internal Medicine Program in Georgia says hands-on US clinical experience is not required, however, is highly recommended. Note that they use the word hands-on. If you do observerships, many people find that it's difficult, harder to secure a strong letter of recommendation because you're essentially shadowing. And so that limits the ways in which you can demonstrate your skills and qualities. And that sometimes results in suboptimal letters of recommendation, where programs who see these letters often feel that meaningful information or content is simply not there. I want you to heed the words of the University of Florida Department of Neurology. And they say, I quote, "Shadowing is typically not the best route for students who are seeking to obtain a letter of recommendation." Think about it. If someone observes you for several hours over several days, do you think you'd know enough about them to really write a good LOR? Or would your comments be pretty generic? While requesting an LOR of someone you shadow over a longer period of time could result in a good letter, the safer bet is to actually work with that person on something, not just observe, so they can see who you are and how you work. Indeed, many preceptors will decline an LOR request if they don't feel like they really know who you are. So what is meant by hands-on? That's step 3, is we need to closely examine what is meant by hands-on. So you have to ask yourself in any USCE that you're considering, what will I be doing? Such an important question. And I want to tell you why. One survey showed that most program directors felt that new interns should possess certain skills at the time that residency starts. Program directors will look for evidence of these skills in the residency application and in your letters of recommendation. So this is a table taken from an important article published in 2017 in Academic Medicine by Angus and his group of researchers. They queried internal medicine program directors and they asked them, what skills must a new resident in internal medicine have at the time that residency starts? Now you'll see the skills on the left, and the percentages you see on the right, the shaded bar there that is black is the percentage indicating that that is a must-have skill. So gathering a history and performing a physical exam, 94% of IMPDs said their residents must have this skill. The number to the right of that in the gray shading is the percentage of PDs that said they should have this skill. And you can see some of the other skills they're looking for is being able to present patients, being able to document a clinical encounter in either written or electronic format, being a contributing member of a healthcare team, recognizing when a patient is really sick and needs urgent or emergent care, being able to develop a prioritized differential diagnosis and establish a working diagnosis, and the list goes on. So you can see that from an observership or a shadowing experience, it would be very difficult for an attending physician or preceptor to be able to assess these skills properly. So this is why these hands-on experiences are very, very important. Step 4, you have to ask yourself, will I have a chance to earn a letter of recommendation? Now remember, in any clinical experience that you do in the US, letters of recommendation are earned and performance-based. The better you do, the more likely you are to have a stronger letter. So no matter how you secure your USCE, whether you're going after university experiences, whether you're trying to land them through cold emails, whether you're using your alumni network or choosing to go with a rotation provider, you need to ascertain the process for obtaining a letter of recommendation. Every entity and individual is going to have a different process, and you need to be aware of what those policies are. And if there's any restrictions on the process, you don't want to assume that they're going to make an exception for you. So what do I mean by that? So let me share with you some LOR policies at select institutions in the United States. We'll start with UCLA Health, who writes that UCLA Health is unable to provide any rec letters regarding your participation in the observership program. The MD Anderson Cancer Center observer experience is not for credit. Therefore, certificates and letters of recommendation cannot be issued. Brigham and Women's Hospital professional staff will not be expected to write letters of recommendation for clinical observers. Now, does this mean that you should not do an experience at these institutions? These are great institutions. We highly recommend considering these institutions, but you have to pay close attention to this type of language, because you may go to these types of institutions and not secure a letter. Now, if your intent is not to get a letter from that institution, then that may not be much of an issue. But if that's a vital part of your plan, you don't want to go in there thinking that this is absolutely going to happen for me. And that's what I mean by paying careful attention to any restrictions that they have in their policies. Step 5, you have to assess how much time you will spend with the preceptor. We do meet a lot of students and rotators who do what we call short duration USCEs. And we define that as US clinical experiences that are 1 to 2 weeks. We do not consider these to be ideal. And the reason for that is that it takes time to adjust and adapt to the demands of a new clinical experience. In my educational research at Baylor, when I look at Baylor medical students and when they reach their peak performance, it typically takes 2 to 3 weeks into a rotation for them to get familiar, understand how things work, and really show their true abilities. So if you're doing 1 to 2 week rotations, it can be very hard for a preceptor or attending to get a true sense of everything that you have to offer. And that obviously puts you at a major disadvantage. So you want enough time to show your true clinical abilities. If you don't have enough time with the preceptor, the consequences of that, of course, is that you may either not secure a letter of recommendation, or you'll get a letter of recommendation that's suboptimal. And remember, that's not what we want, because letters are the second most important factor in the selection process. So in our view, ideal length of a US clinical experience with a single preceptor is 4 weeks. That is akin to what the typical US medical student does in medical schools across the US. Now, one other point of caution: if you are looking at a longer US clinical experience, don't assume that you'll be working with the same preceptor for the entire time. So what do I mean by that? So if you are to land, for example, a university elective, Keep in mind that many university electives are structured in a way where the attending switch off at 1 to 2 week intervals. So over the course of a 4-week university elective, it's entirely possible that you could work with 2 to 4 attendings. And again, that short duration of time with the attendings may make things difficult. You have to factor that into your overall rotation plan. Step 6 is to select a U.S. clinical experience with a small number of rotators. So a vital question to ask is, how many students or learners will be rotating with you? The more learners that there are, it can present challenges. It may limit your clinical opportunities. It may affect your contact time with the preceptor. It can impede you from developing a strong relationship with that preceptor. And of course, it can have an effect on that quality of your letter of recommendation. So no matter how attractive a clinical experience looks in other aspects, we don't want you to ignore the number of rotators. So we would encourage you to give very careful thought to experiences where there are more than 5 learners. It may not be the best experience for you. Step 7, we want to be very choosy, very careful about the people that we work with. Arguably, the most important aspect of a clinical experience is the preceptor. And we want to work with people who are great role models. So we need to ask some important questions about the preceptor. Number 1, does the preceptor have excellent character? Are they patient? Are they humble? They're caring? Do they have a kind heart? Are they empathetic? Is the preceptor a good coach and mentor? Are they nurturing? Are they supportive? Are they encouraging? These are very important when we're getting our careers established in the United States. Is the preceptor someone that is inspiring? Are you inspired to take better care of patients because of their clinical abilities? Do they spend a lot of time with you teaching? And do you get a lot out of that? And is that inspiring you to do the same in turn? Maybe they're inspiring because of their mentorship. So they can be inspiring for any one of a number of reasons, but it would be great if we can work with one of those types of role models. Now, do not assume that all preceptors are cut from the same cloth. This is something that is very preceptor dependent and is worthy of your attention. And what I want you to do is dig deep. And if you come across any information that suggests a preceptor won't be a great role model, don't ignore that information. Step 8, select preceptors who will care about you and your future. So it's not just important to be a great role model. Are they going to be invested in you? And how do we define a caring preceptor? We can define this in many different ways, but what things to look at is this a preceptor who's going to think about you? Are they going to work to help you grow personally and professionally during the time that you're with them? Are they looking out for ways to get you involved? Are they empathetic? Do they remember what it was like to be in your shoes? And have they lost sight of that, or do they always remember that? Because that empathy is important when you're working with students. Are they someone who's identifying new opportunities for you? Not just clinical, but there may be other opportunities. Volunteer work in the community. Maybe they'll connect you with their colleague who's doing research. So, someone who identifies opportunities, someone who might be willing to introduce you to others, somebody who might recommend you to others for these opportunities. And then finally, of course, is this someone who would be invested in writing you a letter of recommendation that you deserve based on your performance? Step 9, select preceptors who are invested in writing a meaningful letter of recommendation. So assuming that we performed well, the preceptor should be committed to writing us a strong letter of recommendation. Now, we would expect that preceptors know how to write strong letters of recommendation, but keep in mind that many letter writers in the US are not trained in how to do that. And that is something that you have to take into account. So one of the things that we do here at MD2B Connect is I attend conferences, societies, professional meetings, where I interact with different academics, people who are in charge of residency programs, and I try to stay abreast of what people are looking for in these letters. And I communicate that with the preceptors in our program. That's something that is very important, that your letter writers stay current with what's needed in these letters. Now, to write a strong letter recommendation, you absolutely have to earn that, right? It's performance-based, but it requires a lot of time on the part of the preceptor to write that letter. It needs to be personalized, it needs to be detailed. And this is another point of caution. If the preceptor is someone who has high numbers of students, that may make it very difficult for that individual to write a highly detailed and personalized letter of recommendation. So that's something else to factor in. The last point about letters is we believe that letters of recommendation should be collaborative. So at Baylor, where I'm a professor, I will work with medical students throughout the year, some of whom I'll work with 9 months, 10 months, sometimes even a year before they will apply for residency. And when they come to me a few months before their residency application is due and ask me for a letter, I'm happy to support them. And I remember the qualities that made them stand out. But what I may not remember as well is some of the examples or the patients or the stories that back up those qualities. And so I invite my students to provide me with valuable information, which will jog my memory. I sometimes have them fill out questionnaires. And to sum it up, it's a collaborative process. And because I'm working with my student, I'm able to write a more meaningful letter. So when you're selecting clinical experiences, think about, again, is this preceptor who's invested, and will they be collaborative to help me write the letter that I deserve? Step 10, create a properly sequenced U.S. clinical experience plan. So no matter how many months of USCE are planned, the sequence or order of these rotations matter. They matter a lot. Now, I'm going to tell you my own story. I'm not an international medical graduate. I did my medical school education here in the US. So I was very familiar going into my clinicals with the US culture and the healthcare system. My first clinical rotation in the US was a family medicine rotation. It was a 1-month rotation. Prior to that, I had very limited clinical experience in the US. It essentially entailed just some physical diagnosis that I had done. And so in my first rotation, I struggled, not just a little bit, quite a bit, because I wasn't sure how to do things. My history taking skills were not yet refined. My oral case presentation skills, I hadn't really done that very much. So I was stumbling around with that. And so I had a lot of growing up to do in that first month. My second rotation was a 6-week psychiatry experience. Now, I was better off in my psychiatry experience because I had a 4-week family medicine experience, but I was still uncomfortable with a lot of different things. My third rotation was my 12-week internal medicine rotation. By the time I got to internal medicine, I was much more seasoned. I knew how to present patients. My history taking was more refined. I knew how to document my encounters. And so I was able to show my true abilities in my third rotation. So when we look at learners, US, MDs, DOs, IMGs, it takes time to show your peak level of clinical ability. It's not that you don't have a great foundation in India or wherever your home country is. It's just that we have to apply those skills and that foundation in a US context. And because we're unfamiliar with the culture, the ways in which the attendings and residents think and operate, the patients in the US, we may not reach our peak level quite often until 2 months into our US clinical experience. So what does this mean for the order of rotations? We see a lot of people do university or audition rotations very early in the process, sometimes as early as their first month in the US. It will be very difficult for a learner that's unfamiliar with US medical system to shine in the first month or two in a university or audition rotation. So we advocate that you, in creating your plan, think about the first 1 to 2 months being hands-on rotations where you're going to be given the duties and responsibilities similar to what you'll be doing in a university or audition rotation. If you can do that, and you're working with somebody who's a nurturing preceptor, who's kind, who's caring, who creates a safe space for you to grow and make mistakes, you're going to be in a better position to shine and succeed in a university or audition rotation. So your sequence and order of USCE is absolutely important. Now, some USCE pitfalls to avoid. We meet a lot of students who don't take much time to research the options. There's a tremendous amount of information out there. People spend a lot of time thinking about their USMLE, but it often surprises us what little research they do for your US clinical experience. As we have said, this is one of the most major decisions and important decisions you will make in your journey to a successful residency match. So please take the time to extensively research your options. You have to ask the right questions. So our step 1 through 10 blueprint, these are the types of questions that I want you to ask when you're considering any type of USCE. Doesn't matter if you're cold emailing people, if you're reaching out to your alumni network, you're going after a university rotation, or using a rotation provider. I also don't want you to ignore any danger signs, anything that you encounter, whether it's language on a website, reviews about a rotation, comments on forums that you visit, because there can be some danger signs, okay? And assuming that you're not going to have that problem is not always the best way to go. So look on these websites about any policies that say you will not get a letter of recommendation from this experience. Look for any evidence of where there's going to be too many rotators. Look for any evidence that that preceptor is not going to be caring. That's an important part of this process. Now, when you're choosing rotations, there's this perception out there that outpatient rotations don't matter or matter very little. That couldn't be farther from the truth. When you become a resident, no matter what specialty you're going to be in, you're going to be working in the inpatient and the outpatient arenas. And it requires different skill sets. And what programs are looking for is evidence that you will be successful in both arenas. So do make sure that part of your USCE plan includes some outpatient work. And finally, all of this good advice can be undone if we're overly fixated on one thing. And one thing we see time and time again is people obsessing over hospital letterhead. Hospital letterhead is just one part of your selection process for USCE. It is not the most important part. When we review applications here at Baylor and we're looking at IMGs, we are not looking at, oh my gosh, this person did a Brigham and Women's rotation, or oh my gosh, this is great, this person did a UCSD rotation. What's most important to us is, what does that letter writer say? Does that letter writer know this applicant very, very well? What did this person do in the rotation? Is there evidence that this person has the qualities that are going to make for a successful resident in our program? So it's about the content, much more important than the letterhead. So when you're evaluating experiences, don't just discount experiences because there isn't a hospital letterhead. Now, we're going to transition into a little bit more about MD2B Connect. I'm going to hand this over to my partner, Manish. Manish, you want to jump in?
Yep. So what we're going to start with is explain our process and how it ties back to all the things that Dr. Desai just talked about. So you get a little bit better understanding of, if you decide to work with us, what that looks like. So Samir, if you want to go to the next slide. Yep. Okay. So really, if I had to summarize what our process is all about and our how it ties to our values and what we feel is important, it really comes down to personalization and mentorship. So what that means is we want a process that is the opposite of buying something on Amazon, where if you were on Amazon, you would go somewhere, point, click, purchase something, get a product or a service. We feel that with this process is so complicated, so deep, there's so many factors to it that's exactly how you don't want to do it. We want to really, the key is getting to know our clients first. And so what that starts, our process all starts with a free introductory meeting. So if you go to our website, you've filled out some basic information about yourself. The first thing that we do is set up an hour-long introductory meeting. And in that meeting, we go deep into your background, what your goals are for, your specialty, what you want to get out of a rotation experience, what parts of the country that you might want to do a rotation experience. So we talk with you and take notes on all the things that are important to you, because as Dr. Desai mentioned, in selecting the right USCE, we have to know all these parts of your history and the parts of your goals, so we can develop a good plan with you. So during that meeting, we'll also explain, we'll give you some strategy and advice, based on all the years, the principles in Dr. Desai's book, The Successful Match, and all our years of working with thousands of clients. We want to give you some strategy and advice in this meeting. And then our team will also explain how our process works step by step, so you understand after the introductory meeting what the process looks like. So really the key for us is we don't believe we can tell you the best plan of action until we understand your situation better. So that's really the goal of the first step of the process. So we go forward to the next slide here, Samir. What the next part of it is developing a plan that we're going to recommend to you. So we have 170 rotations or so in more than 30 cities in all different kinds of specialties. So after the introductory meeting, our team sits down together. The representative you talk to, myself, Dr. Desai, we all talk about your situation, your CV, what your goals are, and we come up with a specific plan for you. So it's not a generic plan where we just say, okay, well, here's a menu of rotations. Please pick what you want to do. And we think this is a very big differentiator in our company versus other providers that are out there, or even if you were selecting on your own. We're taking our knowledge of what you have told us about yourself, and we're taking our knowledge of our preceptors and all those things that Dr. Desai mentioned in finding a good rotation. And we are going to put that together, and a few days after our introductory meeting, send you a specific plan for your situation. And so you'll get that plan. And at that time, we feel it's very important to have this be a process where we work together with you. We're not going to say, oh, you have to do this. We're going to tell you what we think is best, and then we're going to take your input and say, okay, I like that rotation, or I have a question about this rotation. It's really important for us to get your input into the process. So at this stage of the process, we want the back and forth and discussion, and then agree upon together as a team, hey, this is the rotation or rotations that are a good fit for your situation. Okay, so if we can go to the third step. And then after that is done, then we start going through the process steps that secure the rotation. We get the dates that you want to do the rotation. We ask the preceptor if they're available at that time. Then if that is true, then we start moving forward with the payment process and collecting all the documents that we need from you. And in this whole time, you have someone from our team, and our whole team is supporting you, but we will also have a dedicated representative that you always have the chance to talk to. So you're not alone in the process as we're going through it. 4 weeks before the rotation, we'll send you a welcome letter that will tell you what is needed for the rotation. And then during the rotation, as after you've secured the rotation, we're in touch with you during the whole experience. You get a chance to talk to and or meet Dr. Desai based on, if you're in Houston where he is, or you can meet other parts of our other team members if you're in Detroit where I am, or we have some team members in Florida. So the point of this step of the process is that we're always with you through it. We'll always clearly explain what you need to do, what information you need to provide. We'll give you mentorship about the rotation itself and the residency application process. If any issues come up, we're very much available to work on and address those things. So, communication and being in close contact, for us, it's important to have a good relationship with our clients, good relationship with our preceptors. And this is, key to making it a different process than some others that you might find out there. So those are, the main points of how we do things at MD2B Connect. We think, as I said a couple of times, it's very different. And we found through having hundreds of clients go through this, that it's been very rewarding for both in the clinical experience itself and the follow-up and the feedback. It's been a model that's worked very well for us. So that is those are basic process outline and really tied back to developing an optimal clinical experience and really having the values of being transparent, open, and giving expert advice for your specific situation. Okay. So I'm going to hand it back to Dr. Desai, and we'll do some question and answers here.
Yeah, absolutely. So before we get into questions, just wanted to tell you all, when we created MD2B Connect, we didn't want to make this just about a clinical experience. We wanted to get to know you in depth, understand your unique situation, and be a source of support, mentorship, and guidance. We believe in having a long-term relationship with our rotators, and that's something that we hold very, very sacred, is important to us, because we know that when you're coming to the US from all over the world, it's not easy finding credible information, having support, having mentorship. So our program is about much more than a clinical experience. And we experience so much joy when you all match successfully in March here in the United States. And that's what we want for all of you down the road. And anything we can do to help you get there, we would love to do that. Now, for your questions, I wanted to thank you to all of you. You submitted some great questions, a lot of questions, and we're going to try to get through as many as we can. And now, there were a lot of questions with overlap. So if you don't see your exact question addressed here, it's because it's been either addressed in this section already, or it is very similar to another question we've received. In the event that we don't get to your question, it's not because your question isn't important. It is. It matters to us. But if it's not been addressed here, I want you to directly reach out to our MD2B Connect team so we can address that. So one question we received is, what is required to apply for a US rotation? So if you are a current international medical student, one great option for you is to do a rotation at one of our universities. For example, I work at the Baylor College of Medicine. So we have, about 150 medical schools across the country, many great medical schools with great rotation opportunities. A lot of these institutions are part of the AAMC VSLO, the Visiting Student Learning Opportunities. And so if you attend a medical school that's a member institution of VSLO, then you definitely want to explore that as a conduit for getting some university type rotations. Now, in terms of what is required to apply for these rotations, each institution has its own set of requirements. But this table taken from the AAMC website gives you some guidance on some of the standard items that would be required to apply. So they include things as the immunization form, background check, your CV, of course. Institutions may want to see that you're BLS or ACLS certified. They may ask for a letter of recommendation from your home country, proof of liability insurance, a letter of interest or personal statement, photo, transcript, and of note, many institutions do want to see a USMLE score. Now, if you're not at a medical school that's part of VSLO, all is not lost. There are some institutions, that would take people outside of VSLO, and again, their requirements would be specific to that particular facility. So you want to find out what that is. We had a question, very important question. How can I build my CV? I want all of you to do an exercise today, if you have a little bit of time, and that is to take a piece of paper and write down every experience you've done that you can think of. Volunteer experience, community service, community outreach, teaching, mentoring, research, and there are many other categories. But I want you to just write those down to get a sense of how many experiences you have. Because if we look into the future, specifically towards our residency application, on that application form, you will have the opportunity to list 10 different experiences in what is called the experience section of the application. For each experience you list, you'll have a description box where you can describe in detail what you did during that experience. Now, if you do this exercise today and you find out that you have 2 or 3 experiences, then we need to do some resume building between now and when we apply for residency. If you do this experience and you've got 15 experiences, more than those 10, well, that's great, but then you need to look very carefully at the nature of those experiences. Are you very heavy in one area, or are your experiences distributed through many different categories that what we talked about earlier about being well-rounded? And so this is a very, very useful exercise to do today because it gives you a snapshot of where you are today and allows us to strategize on what to do in the months to come or the years to come before you apply for residency. So do this analysis, determine how well-rounded you are, identify your strengths, look for the areas you need to improve in, and create a targeted plan to strengthen your profile over time and use the available time to your advantage. Now, many applicants, they get caught up in other things, right? So obviously studying for steps is very time consuming, but it's often doable to move your CV forward by being very strategic, even during the times of step studying. So you need to have a strategy to build this over time, because otherwise what happens is if you decide to wait until just a few months before you apply, you may not have enough time to make this part of your application very robust. So do this exercise so you can see where you are today. We had another question. How can I find clinical research? We had several questions of this flavor. Clinical research opportunities vary, of course, all over the world. If you're in a country where perhaps there's not as much clinical research as what we have in the United States, that can be a barrier. But to begin the process, I would survey the landscape in your country to determine what is available there. There may be some opportunities in your medical school. There may be some opportunities through organizations in your home country. That's a great place to start. Now, there are other ways to find clinical research. When you come to the US for your US clinical experience, there may be opportunities there. We've had rotators who have taken part in projects. These are usually short-term projects because you're usually at a rotation site for about a month. So some rotators have written case reports of interesting patients, case series, review articles with preceptors. Some have been able to observe clinical trials. Some of our preceptors have clinical trials going on at their practice sites. Some students have done quality improvement projects or practice improvement projects. That is something that could be done, but you won't be able to easily do a long-term research project because in your clinical experience, you're moving usually 1 month here, 1 month there, but you may be able to find things in this manner. Now, if you can come to the US and spend a longer period of time, we do have research opportunities in institutions, academic centers, which are usually about a year. You can find these opportunities on institutional websites. Those that are published are very, very popular in competitive land. Many of these opportunities are not published, so you want to try to network with IMGs and other individuals so that you can be having relationships with people who can inform you when opportunities open up. Quite often, long-term research positions in the US are filled through the people that the PI or research mentor knows internally. So if you can establish these relationships, you can have an opportunity to land a position that doesn't get publicized. Conferences in the US are a great venue to meet lots and lots of people all under one roof. And that's a place where sometimes this networking can be had, and you can really be brought to the forefront for potential research opportunities. And people also do land these opportunities through cold emails. It often requires hundreds and hundreds of emails that need to be sent. If you're going to go this route, these have to be very carefully constructed, because if you send out generic emails, you're not going to get the results that you would hope. What are some other questions that were submitted? A lot of these are clinical in flavor. So are observerships sufficient for the match? We talked about that in our 10-step process. It's not that you shouldn't do any observerships at all. You can consider them, but consider them on a case-by-case basis. We, of course, favor hands-on clinical experiences for all the reasons that we cited. How do we select a rotation? What makes a clinical rotation program better to select? I think, again, I would refer you to that 10-step process, because that's going to help you assess that rotation and whether it's the right fit for you. I think we covered this next point. I'd like to know the process of applying for clinical rotations in the US. How do clinical rotation opportunities change across state lines, and what about Texas? Okay, so for the most part, there aren't major differences between states. I will share with you an important point about New York. There is something called the New York 12-week rule, which is if you do more than 12 weeks of rotations outside of your home country, these are rotations that you're doing for credit at your medical school, you will not be eligible for residency training in the state of New York. They have some exceptions to this rule for certain medical schools. So this is a rule that many people don't realize. So I caution you, if you're a current international medical student, to not exceed that number. Otherwise, the state of New York, which is, as many of you know, a very popular state, high concentration of IMG-friendly programs, may be off limits to you. And that's, of course, the last thing you want to happen. Texas, many clinical rotation opportunities here in Texas. I'm based here in Houston. We have several universities here: Baylor College of Medicine, UT Houston at McGovern Medical School. We have University of Texas Medical Branch at Galveston, University of Texas Southwestern in Dallas, and the list goes on. So you can explore these universities. At MD2V Connect, we also have many, many rotations in Texas. I'm based here in Houston, so we have a large number of clinical experiences here in Houston. This last one, I would like to know more about U.S. clinicals. I think we've covered a lot of those points. More questions. How do you secure a hospital or university observership as a graduate? Each hospital or university is going to have its own process. So please do visit the relevant web page on these hospital and university websites to understand what that process is. There's no one-size-fits-all process. So you want to really be in the know to understand what is going to be required. What's the crucial step to be selected? There are many important steps. I think there is more than one key step. I would say one for sure is to start this process early, especially if you're aiming for university rotations or audition type of experiences. There's a lot of popularity for these experiences, both among US MD and DO students and IMGs. And so starting this process well in advance of when you want to rotate will make it more likely for you to land that position. So in some of these universities, they may need you to start the process a year in advance. Now, if you can go to these websites now to become familiar with their process and their requirements, you can get all of those requirements done so that if you are selected, there's not going to be any delays in your ability to partake in that experience because you haven't fulfilled any of their requirements. When and how to apply for these clinical experiences, I think we just addressed that. How to find good observerships that don't cost a fortune. So if you look at these university rotations or electives or observerships, many are quite expensive. UCSD, for example, has a 2-month program that it costs, last time I checked, $5,500 per month. So you would have to have an expenditure just to rotate of $11,000 for those 2 months. The Harvard affiliated institutions also very, very expensive. University of North Carolina, we're talking about in the order of $5,000+. So that can be prohibitive for many applicants or many rotators. So ways to find more economical choices would include to lean on your alumni. So if you attend a medical school where you've had people who have navigated this process before you, that would be a great place to start. They may be able to share with you their own insight and what they did. They may have landed some things that weren't as expensive. So starting there, I think, is a good place to begin. I will also say that you can send out cold emails. Again, usually if you do this, it's going to require hundreds upon hundreds of emails. But should you land something via cold email, that's great. But don't forget to run through those 10 steps that I mentioned earlier, because just because you land something there doesn't mean it's going to be the ideal experience for you. So I want you to be thoughtful in evaluating any type of experience. How to increase the chances of acceptance of applications. I'm assuming we're referring to US clinical experience applications. Again, getting off to an early start, being aware of what all their requirements are, making sure you have all of those taken care of. All of that is going to significantly improve your chances of landing what you want. And that brings us to the end. So let me stop the sharing here. Alyssa, do you want to jump in?
Yeah, of course. So I did share during the last portion of the webinar some of our resources. So that is information to go to our website, our Instagram page, Facebook. We also have an IMG-friendly residency programs tool, which can be super useful, especially when figuring out, what programs to apply to. So that's all information that we have gotten and crafted on our own accord. So you can find that all on our website. So please check the chat so that way you can have those resources. And I just want to say thank you all again so much for joining us tonight. At MD2B Connect, we really do care about each of our clients. And that really starts with just having a conversation and understanding your background. And we really want to make that connection with each of our clients and understand how we can be there for them. So, we hope that we get the opportunity to talk to you And thank you so much for giving us that opportunity again tonight, just to speak to you and kind of explain, the residency process as well as our rotation program. So thank you so much for having us. And I will pass it back to Manish for some final remarks.
Yeah, I was going to say with the couple questions and a couple that came up in the Q&A. I don't know if that's something that we want to quickly address or have the time to address. I think we have a couple more minutes. Do we want to do that?
Sure. Yeah.
Sure. So I answered one question. So there's only one question.
One other one. Yeah, that's what I thought. I thought I saw them in the chat there and or in the answers, and with a couple minutes. I just wanted to talk about the meets real quick. I think Vishal wrote a couple of questions here. So one of them that Alyssa wrote back on, I did want to point out and talk about, because it's probably is in a lot of people's minds. Is what's going on with the H-1B visa situation in the U.S. So Alyssa wrote, and that is accurate, is that we would not say that we're visa experts, right? But it is something that is really relevant. The one thing that we can say is it's a fast-moving situation. We don't know whether the new rules are going to apply for residency programs or not. That's still being sorted out. There might be exemptions, they might not. So that is something where you will definitely have to keep your eye on the news and see what other sources of information are out there. How residency programs eventually handle H-1B there's a lot going on, and we can't tell you definitively what the answer is going to be. So really not much more we can add to that, but we do want to acknowledge that there's a lot of unknown with the H-1B program or visa program right now. But the hope is that there would be a minimal impact on residency programs, but we're not sure about that right now. I don't know if there's Samir or Alyssa, anything more you want to say about that?
No, I think that's well said.
Okay. And then what was the other question there was, do low scores on step 2 affect selection for USCE? I don't, Samir, you can speak to overall whether, programs in general have a step 2 CK criteria for US clinical experience. In our program, the large majority of our rotations do not have. There are some but it's a very, very small minority. So your step 2 CK score, as far as MD to be Connect, would not have a major influence on rotations and USCE selection. I'm not sure in the larger world, Samir, if that's a criteria or typically.
Yeah, no, that's a very good question, and some U.S. clinical experiences will have no issues whatsoever with any type of step 2 score, but there will be some situations where it's going to be part of their selection process. So, for example, if you're looking at audition type rotations, one of the purposes of audition rotations from the residency programs standpoint is that they want to bring in people who are potentially a good fit for their program, and they may define that fit in different ways. But one of their criteria may have to do with academic criteria, and they may have some non-academic criteria. So if part of their academic criteria is they're looking for people with a certain step 2 score, then they may not see that individual as the right fit. And since their audition rotation spots may be limited, they may prioritize people who have a certain type of step 2 score. So that could be in play at some places, but other places it won't be a factor. It'll just be important that you've taken step 1 and then you have a step 2 score.
Okay, thanks. And then I just wanted to reiterate what Alyssa said, and thank you so much for being part of the webinar today. It's really important to us to, as I said, our important values. We want a personalized process. We want to give you a lot of mentorship and advice, and that's what we try to live by and how we've set up our whole program. So for hopefully the information was useful today. For any of you who we get the opportunity to work with, we look forward to that and wish you the best of luck.
So to close, I just wanted to say thank you again for joining us today. We really appreciate your time and this opportunity to inform you about various aspects of the residency selection process. We admire what you all are doing. It takes a lot of courage to go through this process, and we're here to support you in any way that we can. So we wish you all the best as you move through this journey.
Okay. Rodney, any final words that you would like to say or anything?
No, I just thank you, everybody. I think we'll be sharing a recording of this session. So you should get that in your emails. And if you do have any further questions, feel free to reach out to us at info@soma.health, and that's SOMAA.health.
Okay. Alrighty. Thank you, everybody. Have a great night.
Take care.
Thanks.